Okay, good evening. I'm with Catherine Ward, Eastern Region Unison member, and works at Bedford Hospital. And we've been talking about what's been going on with the closures of the children's paediatric ward last year, and what we did to campaign about that, and the upcoming changes to the hospital services at Bedford and Milton Keynes Hospital. Evening, Catherine.
Evening.
So, tell us what's been going on.
Okay, so last year we were threatened with the closure of paediatric services, but because of the public outcry, the services have been reinstated temporarily. All of the junior doctors are not yet in the hospital. They're all coming in, but not yet. So the deanery has said yes, we can have our doctors back. So that's kind of stalled. But the other thing that we're facing at the moment is that the local CCG are looking at putting all the health services out to tender. So it's not just things in the hospital, it's also community services. They're inviting all bidders, which will threaten our A&E services, because they're saying that we can't function as a full running A&E service. We were supposed to have had a consultation about what changes we wanted to see as Bedford people, which they started earlier on this year. I think it started around March time, and it was supposed to close in June, and the public consultation was supposed to happen, but this has now been moved back. Apparently there was 34 proposals for Bedford and marked down to 14, and Unison discovered that out of the 14, none of them were saving Bedford A&E services. It was looking at different options, but none of them having an A&E service. So we kind of questioned this, because saying how can you come down to 14 when there isn't any public consultation? But at the moment the review has been put back, although we've now seen that they've put about up to 500 contracts up for grabs and invited bidders, anyone who wanted, and I think there was about 50 something odd people who've responded. We don't know who they are, we're waiting for a list, but that could be anyone, that could be G4S, that could be Circle. In terms of that, gives us a worry as Bedford, because that is just opening all our health services to privatisation. So not just the hospital services, that's your community services, so things like your dental services, things like your children services that are in the community, your mental health services. So that could be anyone delivering. And we as Bedford people haven't yet been consulted on what do we want and what do we want to see. We understand that there is changes that need to happen in the hospital. We need to modernise, but modernising doesn't mean closing down. It means looking at who we can work in partnership, which we already do at Bedford Hospital. Our cancer services, we share them with Adam Briggs. We have children who go all the way to London for different services because of specialisms. So we understand that. What we don't want to see is a closure of a service under the sell-off saying that, oh, it's because we are modernising. So we want to have a say in what we want to keep. We still want to have a functioning A&E services in Bedford. Yes, we know that they won't be able to do all surgeries there, and they won't be able to do all things there, but we want them to be able to do first care there. So if you were injured, to be able to be seen to, and then if you needed to be moved on, you get moved on, like already they do now. So we understand that, and we're just asking for people to support our petition to say hands off Bedford health services, because not just Bedford Hospital, but everything around Bedford is now up for grabs. Bedfordshire people, what you need to do is not keep an eye on the CCG, because they're not an elected body. You used to be able to complain about the PCT, but with the CCG it's various people, so you need to keep an eye on what they're doing. Make sure that you keep informed, and if you see anything that's happening, any changes that's happening, you either notify your local trades council, or you do something about it and raise awareness about it, because if we sleep, we'll wake up the next day with a private health service. Thank you.
Thank you very much.